Euthanasia. Imagine finding out you have an incurable disease, or that you have stage 4 cancer and it cannot be treated. What would your options be? Try and treat it, letting your body go naturally, suicide? We all know that suicide is wrong, and that killing someone is wrong. But in many cases, when someone finds themselves in this situation, they turn to euthanasia, also known as physician-assisted suicide. Euthanasia is the practice of painlessly putting to death people who have incurable, painful, distressing diseases or handicaps. Today, I will go over the different types of euthanasia, methods to perform euthanasia, where euthanasia is legal, reasons people decide to turn to euthanasia, and reasons why I believe euthanasia is wrong. There are 3 types of euthanasia: voluntary, involuntary, and non-voluntary. Voluntary euthanasia is when the patient has consented to it, such as the patient asking the doctor to withhold treatments and let them die. Involuntary euthanasia is when the patient is unable to give consent to the procedure. Examples of this are if the patient is in a coma or if the child is being euthanized. Non-voluntary euthanasia is when a patient doesn't want to undergo euthanasia but is forced to anyway. Most of the time, the reasons that people undergo euthanasia is because they have illnesses that cause them unbearable pain, although sometimes if a person becomes handicapped and can't deal with the stress of it, they will also turn to euthanasia. Some methods of euthanasia include passive and active. Passive euthanasia is mostly done by giving them lethal dosages of prescription drugs. There are a few different types of active euthanasia, including shooting someone, lethal injections such as injections to stop someone's heart, denying a patient food and water or other drugs to treat them. This is most commonly done to newborns or who are sick or disabled or people who suffer from diseases such as Alzheimer's and dementia. Though it is not legal everywhere in the United States, euthanasia is legal in 5 states. These are Washington, Oregon, Vermont, New Mexico, and Montana. Outside of the United States, it is legal in Switzerland, Germany, Albania, Japan, Belgium, and many other countries. There are 2 main types of arguments to support euthanasia. They are ethical and pragmatic. The ethical argument says that people have freedom of choice, which includes the right to their own body and life. It also mentions that the state shouldn't be able to create laws that will prevent people to choose how and when they die. The pragmatic argument states that euthanasia, especially passive euthanasia, is already being practiced all around the world, and it would be safer to regulate it. People who are pro-euthanasia give the job of killing someone to the doctors, and there is almost no knowledge of the psychological stress that is given to these doctors in order for them to take a life instead of for them to protect it. People who are pro-euthanasia don't realize that they are making doctors who have to perform euthanasia at risk of depression, suicide, alcoholism, drug addiction, and even becoming divorced. Some people think that euthanasia is not bad and should not be looked down upon. They think that if there is a way to stop someone who is suffering from an incurable disease, why can't they be euthanized as a way to end a pain? Anyway, there are 4 main types of arguments against euthanasia: the religious argument, the slippery slope argument, the medical ethics argument, and the alternative argument. The religious argument is the argument that humans are God's creation and life is sacred. This argument also states that only God can choose when a life will end, so euthanasia is actually a sin. This is believed by many members of the Christian, Jewish, and Islamic faiths, although not all members of these faiths will believe it. Even some non-religious people also believe that euthanasia can make life less valuable. The slippery slope argument states that once a healthcare service starts to kill its own citizens, it could become very dangerous. The biggest concern is that society will eventually change its opinions to legalize not only voluntary euthanasia, but also involuntary and non-voluntary euthanasia as well. Legalizing voluntary euthanasia could eventually have many consequences, including that people who are ill or have bad disabilities and are in need of med assistance may feel the need to be euthanized in order not to put pressure on the people who have to take care of them. It could also prevent treatments from being found for people with terminal illnesses. Doctors may even misdiagnose a patient, and the patient may turn to euthanasia after being wrongly diagnosed. The medical ethics argument is like the slippery slope argument by saying that legalizing euthanasia would violate the Hippocratic Oath that states, "A physician shall always bear in mind the obligation to respect human life." Having a doctor not preserve human life could be dangerous to the relationship between many patients and doctors. It could also become a daily task for doctors, which means doctors would be less caring when dealing with people who are disabled, the elderly, and people who have terminal illnesses. People may also become skeptical of a doctor's decision when treating them. The alternative argument states that there is no reason that a person should feel that they are suffering to a point where they can't bear it, either physically or mentally. According to this argument, if a person is given the right care, there should be no reason why they aren't able to have a painless and natural death. Today I have told you about the different types of euthanasia, the different methods, where it's legalized, reasons why people will turn to euthanasia, and reasons why I think that euthanasia is wrong.